I will be presenting a Doctor of Nursing Practice project titled Preventing Medication Administration Errors by Kristen Pugh. Preventing medication errors is important because they can lead to patient harm and death. By definition, a medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional. Medication errors cause at least one death every day and injure approximately 1.3 million people annually in the United States. Medication errors have been classified as the third leading cause of death after heart disease and cancer. The Joint Commission has named improving medication safety as a national patient safety goal. Medication errors may occur at any phase of the process. The process involves the following steps: prescribing, transcribing, dispensing, administration, and monitoring. Medication administration errors are defined as wrong patient, wrong medication, wrong dosage, wrong route, and wrong time. The percentage of medication administration errors where the D&P project was held included wrong patient 10%, wrong medication 10%, wrong dosage 15%, wrong route 35%, and wrong time 25%. At a nursing home and rehabilitation center located in the southeastern region of the United States, medication administration errors were at a rate of 5.7%. Federal regulations require nursing homes to maintain a medication administration error rate below 5% to maintain eligibility for reimbursement. To decrease medication administration errors below 5%, a Doctorate of Nursing Practice project was implemented to improve patient safety and adhere with federal regulations. The purpose of the D&P project is to use evidence-based research and executive nurse administration competencies to identify and implement best practices for preventing medication administration errors to ultimately improve patient safety. Based on a root cause analysis within the organization, medication administration errors have increased due to nurses being distracted or interrupted during the medication administration and nurses' lack of medication administration competency. The root cause analysis revealed that nurses were being distracted due to visitors, patients, staff conversations, the telephone, and environmental noises. Nurses were not competent in medication administration due to insufficient knowledge and carelessness. And third, the other cause for an increase in medication administration errors were LPN's increased workload, which was due to a lack of the CNA's assistance during medication administration pass. The aim of the project was to develop and implement new medication administration policies and guidelines that support the use of no interruption zones for medication administration, do not disturb medication administration vests, and medication administration educational in-services. The goal of the project was to reduce MAEs from 5.7 to less than 2%, reduce non-emergent interruptions during medication administration by 80%, and improve nurses' medication administration competency rate of 90% or higher. The project took place at a nursing home and rehab facility that can accommodate 150 residents. The organization provides long-term care, short-term recovery, inpatient, outpatient therapy, and rehab services. The project was conducted during the hours of 7 a.m. through 3 p.m., since the majority of medications were administered at 8 a.m. and 2 p.m. During each shift, there were 3 LPNs and 1 nurse manager working in the unit. Each nurse was assigned 2 certified nursing assistants to assist with patient care. Geriatrics is the main patient on the short-term unit, consisting of males and females with an age range of 65 to 101 years of age. Typical diagnoses in the short-term unit include stroke, congestive heart failure, diabetes, hip fractures, and urinary tract infections. The inclusion criteria for the project included patients on polymedication therapy and LPNs that administer medication. The exclusion criteria included patients on single medication therapy, long-term stay unit patients, and administrative nurses. Participants in the project included 35 geriatric patients, 7 LPNs, and 10 CNAs. The project's timeframe consisted of a plan, implementation, and study phase. The plan phase was conducted from June to December 2016. During this phase, a root cause analysis of the organization's med administration errors was performed. The analysis revealed that MAEs were due to interruptions or distractions and lack of medication administration competency of the nurses. The best evidence-based interventions for preventing nurse interruptions and distractions, as well as improving nurse competency, was sought. The best evidence-based interventions were do not disturb medication administration vests, the use of no interruption zones, and nurse medication administration educational services. Med administration policy was developed and incorporated the use of do not disturb medication administration vests, no interruption zones, and nurse med education services. The implementation phase was performed from March 6 through March 31st, 2017. During this phase, the new med administration policy was enforced for 4 weeks. The study phase took place from May 29 through June 16, 2017. During this phase, data was analyzed and studied using various data collection tools that will be discussed later in this presentation. To prevent MAEs, the project developed a medication administration policy that incorporated the use of no interruption zones, do not disturb med vests, and mandatory medication administration in services. The no interruption zone was defined by red tape on the floor and encircled around medication carts. While inside the no interruption zone, nurses were to be uninterrupted or distracted while preparing and administering medications. Nurses wore red aprons with the wording, "Please do not disturb the nurse while administering medications," during the entire medication administration process. The red vest acted as a visual signal for persons wanting to approach the nurse. Staff medication education sessions were conducted weekly. Topics covered in the sessions included frequently used medications, med preparation, med routes, the 5 rights of medication, adverse side effects, and medication effectiveness. There were 3 types of data collected for the project. This included medication administration errors, non-urgent interruptions that occurred during the med administration process, and nurses' medication administration exam results. The tools used to collect the data were the Assess ERR medication tracking form, which tracked the occurrence of medication administration errors. The second tool was the Medication Administration Direct Observation Sheet, which documented the source and number of non-urgent interruptions or distractions during medication administration. And the third tool was the Center for Nursing Education and Testing LPN Medication Administration Exam, which evaluated nurses' medication administration knowledge and competency. Now let's take a look at how the data was analyzed. MAE rates were analyzed using the Consultant Pharmacist Activity Report. In January of 2017, the MAE rate was 4.9%. In March of 2017, the MAE rate was 5.7%, which was part of the pre-implementation phase. In April of 2017, as we implemented the new medication administration policy, the MAE rate dropped to 2.28%. The medication administration direct observation sheet was analyzed using the SPSS software for descriptive statistics. Rates of interruptions per hour overall by source of interruption and distraction were compared. The rate was presented with 95% confidence interval and statistical significance at p less than 0.05. The Poisson regression analysis was applied to examine the association between the interruption distraction rate and interventions pre and post implementation. The LPN medication exam was analyzed using the measures of central tendency for mean, median, and range of scores. The mean score was 79 pre-implantation and 96 post-implantation. The median score was 80 pre and 95 post-implantation, and the range of score was 75 to 90 pre and 90 to 100. The results of the project revealed a 40% decrease in medication administration errors, a 10 to 15 point increase in the exam results score, and a 66% increase in non-urgent interruptions. On this side, we can see the occurrence of medication administration errors. In January of 2017 and in February 2017, the medication administration errors are highlighted. In March of 2017, the medication administration error is highlighted in green. You can see that there's a significant decrease in the rate of medication administration errors. The graph on the left shows the occurrence of non-urgent interruptions. Shaded in the gray is the pre-implantation interruptions, which were on an average rate of 18 interruptions per nurse. Shaded in the gray is the implantation interruptions, which showed an average rate of 11.8 interruptions per nurse. The graph on the right shows the medication administration exam results, where pre-implantation is in green and the nurse's median was 7% to post-implantation, the shaded in the gray when the nurse's median was 96%. In 4 weeks, MAEs reduced from 5.7% to 2.28%. Non-emergent interruptions decreased by 66%, and nurse medication administration exam results, mean, improved from 79% to 96%, with the development of a medication administration policy that integrated the use of a non-interruption zone, medication administration vest, and nurse medication administration in services. The project demonstrated that developing a policy that uses a root cause analysis to determine the best evidence-based practice interventions for a facility is an optimal approach to improve systems, mitigate harm, prevent the recurrence of adverse events such as medication administration errors. The use of new or revised policy and guidelines that tailor to the needs of the facility can improve performance and increase patient safety. The rate of MAEs might have been lower if the project did not take place near dementia patients. Unfortunately, the dementia patients interrupted the nurses while in the no interruption zone and wearing the medication administration vest. Suggestions for future research include conducting a root cause analysis on patients' role with the system needing improvement. Patients can also affect patient care.